This is a lecture actually I've given over the last few years here at Summit Medical Group, but I've focused pretty much on adults. And what we know is that adults experience stress and anxiety differently than younger people do. In fact, we know that when stress goes on for too long a period at too high a level, adults start to experience all kinds of medical and health conditions. For example, when stress goes on for too long a period at too high a level, adults will experience all kinds of these health conditions, and if you have one of these, it's going to make it worse, and if you don't, it can actually bring it on. So things like heart disease, diabetes, infertility, migraines, chronic pain, skin problems, GI problems, you name it, and when stress goes on for too long a period at too high a level, it will make it worse. The other thing we know is that adults also experience other types of reactions to stress. They get all kinds of emotional reactions. When it goes on for too long a period at too high a level, they can become irritable and angry, feel easily overwhelmed. They can get anxious or nervous, feel afraid, worried, helpless, hopeless, and can become depressed. We also know they can experience all kinds of cognitive reactions, and that's a fancy name for thinking. So they have problems with memory, attention, concentration, organization. They can become very ruminative. They play events over and over in their mind that are negative, and they can begin to look at the future and think the future is bad. They can get all kinds of behavioral reactions. They can have difficulty functioning at work and at home, many times because they're irritable and they become argumentative with other people. They can become isolated, withdrawn, paranoid, suspicious. One of the things that we find in the work world is that individuals who are very stressed start to work longer and longer and longer hours, put more and more effort into things, and produce less and less and less. We know, it kind of makes sense when you think about it because they can't think as clearly, they're not as organized, they can't concentrate. Again, we can get all kinds of other bad behaviors like problems with drinking and smoking and eating too much, anger outbursts, sleep problems. So again, we know that when anxiety goes on for too long a period at too high a level with adults, we can get all these bad things. Younger people, on the other hand, tend to experience it differently, and it depends upon their age. So, for example, kids who are around 5 or so, when they get stressed, they'll throw temper tantrums, they'll start yelling and pouting, they'll experience nightmares when they didn't have them before, they'll start wetting the bed when they were dry in the past, they'll start becoming clingy to their parents, have fear of the dark, they can start to engage in some self-soothing behaviors, like they'll start rocking, or they'll even become a little aggressive and start biting people. I have to tell you something, that when one of my children, who's now a teenager, was about 5 or 6, we put him into a new daycare, and he must have been stressed because he kept biting all the kids. Now, I have to tell you what it was like for the shrink to have to pick up his kid every other day because he was biting everybody. So, kids that are a little bit older, when we have maybe 5 to 9, you start seeing different things here. You start to see some health complaints. They start to feel lightheaded, changes in appetite. They complain about their stomach. They experience restlessness. They can become moody and withdrawn, right? They can become aggressive and tend to answer back a lot or get into arguments or fights with other kids. They start to become sensitive and cry when they didn't before. And they can become accident prone. That doesn't mean that they're actually hurting themselves. It means that they're not thinking clearly, they're preoccupied, and they tend to bump into things and hurt themselves a lot. Kids who are about 10 to 12, at this age we might start to see some repetitive or kind of compulsive behaviors. They'll start biting their nails, twisting their hair, clenching their fists. They can also, this is where you start seeing some school problems, right? So they'll skip school, they'll lose concentration, their grades start to slip. They can begin to get a little aggressive, they might bully other kids. They seem worried, and they might start to seem lazy or stop enjoying the things that they once did. Teens, on the other hand, they experience this a little bit differently. Most of their, when they experience stress, is emotional. They will often become worried and anxious, depressed. They'll start to have very negative thoughts about themselves, about their future. They lose their vitality and self-confidence. They become argumentative and fight against everything, although most teens do that. But this is a little worse than usual. You can also see school problems, and it's often when they'll start using drugs and alcohol as a way of self-medicating themselves. So tonight, what we hope to do is give you a better understanding of what stress is, how does it manifest itself in this younger population, how does it differentiate from anxiety, and what you can do about it. So the first thing that I think is important for all of you to understand is that there is no such thing as a stress-free life. It doesn't exist, all right? Stress is the normal reaction of your body to the demands that are being placed upon it. So it's a normal physical reaction. And in stress, when the demands that are being placed upon you are in line with your coping abilities, you tend not to feel so stressed. So for example, this is vacation season. So let's assume you're going on a vacation and you do all of your packing a week before and you do your shopping and you got your bags next to the door when you wake up. You're not going to feel so stressed, right? Because the demands of going away and your ability to cope with it are in balance. However, if like me, you do nothing until the night before and you're running around shopping, trying to pack, and you're waking up in the morning and still shoving things in your bag, right? You're probably going to feel very stressed. Why? Because the demands of going on that vacation are outweighing your ability to cope, or at least you're thinking they're outweighing your ability to cope. That all make sense? Okay. So, based upon that, what causes stress? Anything can cause stress. Anything that places a demand upon us and starts to exceed our coping abilities can be stressful. If you think about young kids, right, or young adults, they're experiencing so many new things that just about anything can be stressful to them. So it can be good things like promotion to the next grade, going into the musical, having a new boyfriend or girlfriend, all new things, but they can be very stressful even though they're good, right? It can be bad things, overscheduled, moving, sibling rivalry, having a bad teacher, or it can be those ugly things like abuse, death of a family member, divorce, etc. All right, so anything can cause people stress. As a result, for young people, which ones get stressed? They all get stressed, all right? It's an equal opportunity employer here. Now, the next question that we have is, why do we get that physical reaction when we get stressed, right? Everybody's experienced that. Let me ask all of you, and just call it out. What kinds of physical reactions do you get when you're stressed? Headaches. What else? Sweating, heart palpitations. Anything else? What's that? Stomach aches, okay, right? So things like sweating, shaking, right? Stomach aches, ringing in the ears, tingling in the fingers and toes, right? Some people get that, or even numbness. So the next question is, why? Why do we get those reactions? Well, when you become stressed, your body turns on the 911 system, or the emergency response system of your body. So stress is that reaction. It turns on that emergency system. Why does it do that? Well, the best way for me to explain that is to use an example and have you all go back to cave person time, okay? Let's assume you're all in your cave, you're with your family, and you're going about your business, and all of a sudden you hear the roar of a lion or the growl of a bear. How are you going to feel? Scared. Ooh, I heard that. Very good. Okay, so you're going to feel scared. What does scared physically feel like? So when you're physically scared, what does it feel like? Heart races. What else? Muscle contract, right? So you can get shaky, right? Sweaty, shaky, heart rate goes up, breathing goes up, thoughts race, right? People can get tingling or numbness in the fingers and toes, stomach aches. That sound familiar? Okay. Why does that happen? Well, most of you have probably heard of this, but when we are in danger, especially back then, our fight or flight response kicks on, which is a way to help protect us to either fight off the bear and the lion or to run away. And so every single one of those physical symptoms actually has a purpose. So your heart races and your respiration goes up because your larger muscle groups need more blood and oxygen, right? You start to sweat because your body's anticipating having to exert itself, so it's already beginning to try to cool itself down. People can have their thoughts race because they're going over their options. Where's the stick? Where's the rock? How do I get out of here, right? Their eyes can bug out of their head. That's called hypervigilance because they're scanning the world for danger. People can get tingling or numbness in their extremities. We see this in kids and we also see this in adults, often misinterpreted as being strokes or heart attacks. What that actually is paresthesias. So when your fight or flight response kicks in to protect you, these small capillaries, the little vessels in your extremities, constrict and push the blood up into your larger muscle groups, into the core of the body where you need it. There's also a belief that the reason that it does that is because if you were to get cut or injured, you wouldn't bleed to death so quickly, right? So it's all protective. People also can get very bad stomach aches. In fact, they can even get nauseous or even feel like they're going to vomit. The reason that that happens is because it takes a significant amount of energy to digest food. And your body is smart enough to know that why should you be taking the energy to digest your hamburger when you're going to become hamburger for another animal? So what it does is it slows it down or it even shuts it off. But then what happens is your food is sitting there, right, and you don't feel good. So all makes sense, right? So the fight or flight response is a wonderful mechanism. It's protected us for thousands of years, and quite frankly, if we didn't have it, we wouldn't be alive today as a species. All right, so now let's go up to modern day time. In our society, in this day and age, the likelihood of you being attacked by a bear, unless you live in West Milford or Chatham, is extremely low, right? In fact, there's some research that shows that the likelihood of you actually being a victim of any violence is lower than the likelihood of you being hit by lightning. So you have a higher likelihood of getting struck by lightning on the golf course than actually being a victim of violence. Now, the media is not going to make you think that, but that's actually the case. So because of that, what's happened over time is your body has evolved, it's adjusted. So rather than turning on the fight or flight response when you are in physical danger, it will now turn on when you feel socially threatened, emotionally threatened, threatened at work. So anytime you perceive any kind of a threat, your body does the one thing that it knows how to do, and that turns on that fight or flight response, and is why we start getting all of those symptoms. So stress, a turning on of that fight or flight response, is not necessarily bad, right? In small doses, it can actually be pretty good. It gives us a burst of energy when we need it. It can increase our motivation because feeling stressed, that's not a good feeling, so we end up doing things to get rid of it. It can also be protective. So if you're, walking down an alleyway, or not alleyway, but if you're walking down in New York City and that feeling stops you from going down a dark alleyway, it's done its job. However, stress can also be bad. When stress goes on for too long a period, at too high a level, that basically means your fight or flight response is kicked in high gear. It doesn't slow down. And so your body can start to break down, right? And you can start having those medical and physical problems we talked about. It also can bring on all those behavioral, emotional, and cognitive problems. How does stress differentiate from anxiety? Well, in a couple of different ways. One, when people are stressed, whenever the event in the environment goes away, the stress goes down, right? So when you actually do your packing and you feel good about that, your stress goes down, you can go enjoy your vacation. Anxiety, on the other hand, tends not to. So with anxiety, we know we usually get a turning on of the fight or flight response, so people start getting physical symptoms, not always, but often get physical symptoms. There's always a lot of worry and concern. So people with anxiety tend to always be looking out into the future, think the future's bad, and then they start reacting physically, emotionally, and behaviorally as if that bad thing is absolutely going to happen, regardless of the fact that bad things only happen about 10 to 15% of the time. It's that worry and concern that keeps that fight or flight response kicked in all the time, even if there's nothing in the environment that's causing any danger or threat. We also tend to see a lot of behavioral problems with anxiety, specifically avoidance. People avoid anything that they think is going to cause them anxious or any kind of danger. And so anxiety problems and disorders tend not to go away very easily. Where stress, again, when the demands go down, the stress response goes down as well. Okay? All right, that's really all I wanted to tell all of you today. I'm going to invite Jamie Schwartz to come up, and what she's going to do at this point is talk to all of you about stress and anxiety in children.
Hi. So tonight I want to present an overview of childhood anxiety and stress, and I'm going to go through normal developmental stress and anxiety, and then I want to go into when to be concerned and some parental and professional interventions. So what is stress? stress is a normal childhood experience, and it creates anxiety, and situations such as death, illness, parental separation, and school and social issues present a very stressful situation which create anxiety for kids. Developmental appropriate stress and anxiety, such as separation anxiety and stranger anxiety, I also call it stranger danger, is typical from infancy through 2 years old. And then we have the early childhood stage from 3 to 6, and you tend to hear about ghosts and monsters and darkness, doctors in hospitals, and of course sleeping alone. So they may express their stress about maybe getting a shot, or what's going to happen when I go to the hospital. And then we have middle childhood. So we see the school performance, social competence, and into adolescence, we continue seeing school performance and social competence and new experience, all being very stressful but normal experiences. And so they're going to experience anxiety, and obviously, the older they get and the more homework they get and the more social experiences that they have, the more stress and anxiety they're going to experience. I just want to give you an overview of different types of childhood anxiety disorders. First, we have the generalized anxiety disorder, which we could see is affecting 3 to 4% of children. And you're going to be concerned if you're going to see it, the excessive worry and anxiety for at least 6 months. Next, we have social phobia. So this is the subtype of specific phobias. So they're shy, they're uncomfortable around people and social situations, and typically when they feel that they're in a situation where a lot of people might be looking at them, maybe that's their concern, they're going to have a lot of anxiety, a lot of stress and anxiety. And next we have the separation anxiety, and that persists for at least 4 weeks that's when we get concerned. So they're having difficulty separating from their caregivers. And then finally is obsessive compulsive disorder. So there we're seeing recurrent obsessions or compulsions that are severe enough to be time-consuming and interfere with their daily living. And so an example I like to give is maybe they have a cleaning obsession, which most parents would say, well, what would be wrong with that? But they're avoiding going outside and playing. So I want to go in and clean my room. I want to straighten up my bookcase, but first I'm going to take all the books off the bookshelf and dust it. And I'm sure you're still saying, well, what's wrong with that? But if it's so time-consuming that they're avoiding going out and being with their friends, then we're concerned. So what are the signs of anxiety in children? Distress out of proportion to the situation. So we're seeing things such as crying and sadness and anger, the frustration, and them being embarrassed in social stressful situations. I want to go back to anger because a lot of the times, especially in school, they may be concerned about academic or social situations, and they hold it together very well sometimes in school, because I'll have a parent come in and say, well, I'm not hearing anything about their behavior in school. They're doing well, and then they come home and they have these angry outbursts. I don't understand. Well, sometimes they hold it together so well that when they come home, they have these angry outbursts. And sometimes they use a metaphor at the shaken soda bottle. So what's going to happen when you pop the top off? It's going to explode. So they hold it together pretty well. And next, the repetitive reassurance questions. So what's going to happen? Who's going to be there? And it can go on and on and on. And then we have the physical complaints. So we have the headaches, the stomach aches, and the too sick to go to school. So a lot of our referrals are from the pediatricians here. And typically a parent might bring them in because they're having these recurrent headaches or stomach aches. And then the doctors rule out any kind of medical condition. And they might ask some more questions, and maybe there's some anxiety, maybe there's some somatic physical complaints going on. We get the referral, and then we'll determine whether or not this is a result of stress and anxiety. So next we have the anticipatory anxiety, which is what's going to happen when I get there? What if all the kids have started the game before I get there? So again, it's the recurrent questions. And finally, difficulty with sleep. So the signs of anxiety, so the perfectionism. So that's driven by the fear, driven by the worry and fear of maybe disappointing a parent or disappointing the teacher. And then we have them being overly responsible or unnecessary apologizing. So again, the fear of getting somebody mad at them. They're stressed in a social situation, and they want to make sure that everybody likes them. It's very stressful and anxiety-provoking. And then we have the excessive avoidance. So again, maybe staying at home, I have a stomach ache, I don't want to go out, I don't want to go to the sleepover, those concerns, which then tend to lead to avoidance. And next we have the disruptions of child or family functioning, and excessive time spent consoling their child about the distress with ordinary situations. So those two together, you know, the example is the family not being able to go out on a family function because their child's concerned. They have worries about what's going to happen when I get there, or what if there's a problem, we have car problems, what if, you know, all those questions. So parental intervention. So first we want to understand the illness, and there's a great book that I like to recommend to parents, and it's called Freeing Your Child from Anxiety. And the author is Tamar Chansky, and it gives a nice overview of the signs, the symptoms, and various types of anxiety disorders, and also the parental and professional intervention. And next we want to listen to your child's feelings, and this gets a little tricky because you also want to redirect your child. So I always recommend that you empathize with your child and you redirect. So I'm sorry that you're so worried. Let's go out and get some ice cream. So it's not spending too much time, because I like to describe to parents that if we focus in on these worries, they're going to grow. So we want to prevent them from growing. So it's important to empathize, listen to them, but then redirect them to something fun. And next is being careful how you describe maybe a cut on a knee. You don't want to go into great detail about what's going to happen if you don't keep it clean. That maybe perhaps it's going to lead to amputation. You just don't want to go there. You want to keep it really, really simple with them. Just clean it up and put a Band-Aid on it and let's go. So just avoiding just creating these catastrophic situations that they really just don't need to worry about. And next we have worry time, which is great. I love this. So sometimes they're constantly asking those reassuring questions, looking to feel better. And I recommend to parents to set up this worry time. I generally recommend, if you could try to be consistent, I know with people's schedules it's a little tough, but maybe 4 o'clock every day, you put a timer out for 15 minutes, let them talk about their worries. If it's not worry time, you're redirecting them back to putting those worries in the imaginary lockbox. Don't create a shoebox and have them write it on a piece of paper and put it in, because you don't want them to pull it out because maybe they forgot about it. So the goal is the imaginary lockbox. Put your worries away until worry time. And the goal is hopefully by 4 o'clock, they have forgotten about some of those worries. And sometimes after a while, they just won't need it. And you can rename that time to talk time, something light and fun. And then finally, we have relaxation techniques. So visualization, helping them identify the happy, safe place for them, Disney World, the beach, whatever they're happy with. And along with that, deep breathing. So it's taking a deep breath in through your nose, describing that your stomach is going to fill up with air, and then letting it out through your mouth. So doing that with the visualization is really helpful. So it's helping their body relax. Dr. Corman spoke about fight or flight. So this is helping your body relax, so then they can then utilize the tools that they need, getting their body in a calm state. Professional interventions. So cognitive behavioral therapy and medication. And then there's a third one, which is the combination of the two. So with cognitive behavioral therapy, we want to give them a basic psychoeducation about how it develops and the skills needed to reduce the anxiety. One of the other parts is teaching them, again, the somatic management skills, such as breathing, the progressive relaxation, which I just explained, and the visualization. And then finally, the cognitive restructuring. So it's helping them identify their automatic negative thoughts, which affect their feelings, which affect their behavior. So if somebody comes in and they say, everybody hates me at school, well, how's that going to make you feel? Pretty bad. And then what might the behavior be? Well, I have a stomach ache today, I don't want to go to school, maybe avoiding the situation. So the goal is to help them identify those three things and reframe that automatic negative thought to a positive rational response. So maybe they determine that maybe not everybody hates them. Maybe they have one or two good friends that they talk to. So when they reframe that statement from everyone hates me to I have a few good friends, it feels a lot better for them. And they're not going to feel bad and maybe not avoid the situation. And finally, for relapse prevention, is to help them identify the potential stressors that might be coming up. So to come up with some plans to deal with it and teaching them the coping mechanisms to deal with those stressful situations. And next I want to talk about medication, just touch on that a little bit. Typically when they go for psychiatric evaluation, a psychiatrist might recommend that they go on an SSRI, such as Prozac or Zoloft. And then we have a class of benzodiazepines like Xanax and Klonopin. With medication, with children, typically what I like to see first is if maybe in a few sessions, if they can actually understand and utilize the skills that that's being learned in therapy. If that can reduce some of the anxiety, then we continue with that. If they're learning the skills but they're not able to utilize the skills, then I'd be concerned that the anxiety is so high that they can't actually put those tools into action. So that's when I would generally recommend that they see a psychiatrist and get that anxiety down a little bit so at least they can use the tools that they're learning. And I think that is it. So I'm going to hand it over to Dr. LeCure.
Anxiety and stress in adolescence, right? So raising teenagers. How many of us here are raising teenagers right about now? Okay, so this is where we really got to flex our skills as a parent, because teenagers will challenge us, right? And one reason that it seems like teenagers are challenging us is because they are dealing with a lot of stress. Adolescence is a time that begins with biological changes of puberty, and it ends with the assumption of adult roles, which nowadays can extend, in a healthy way into your 20s or so. It's a period of extreme physical, cognitive, social, and emotional development, a lot of changes going on, which are healthy sources of stress, but also could be sources of anxiety on any of these areas. So I'm going to go over all these challenges that can occur at each domain. So with the physical changes of puberty, it starts earlier with girls than it does boys. And what we see actually, early onset of puberty works out better for young boys than it does for young girls, right? So a boy who hits puberty before his peers will gain a certain playground status. They'll be a better athlete, and that's something that will be admired. A girl that hits puberty before her peers may stand out more and attract negative attention, and that can be problematic. So different things going on at this stage. Teenagers have an idealized body image, right? This is what I should look like in terms of my body shape and size and what have you. This is influenced, of course, by media, and what they have rarely matches up to what they want it to be. There's emerging feelings of sexuality, awkward physical development, and a curiosity around alcohol and other drugs. So what I'm going to do for each of these domains, on the left-hand side, you'll see what it will be like kind of normal stresses for young people to experience. And on the right-hand side, you'll see things I'll call unhealthy stress and anxiety. Now, any one of these things on the right-hand side does not mean there's a problem, but if you start to see a lot of these things on the right-hand side, you might want to consider a consultation with a therapist. So some healthy stress, some healthy concern is I'm concerned about what I look like, my size, my shape, my physical features. I may not like some aspects of myself, and I might start to take some steps to improve my physique and my eating habits because of this stress. But on the unhealthier side, you might start to see chronic self-critical thoughts. You might start to see interference with social and academic life, withdrawal from things because they don't like how they look, they don't want to be there. Extreme, abrupt changes in eating or exercise habits. So we're looking for like eating disordered behavior here, right? Are they taking diet pills? Are they exercising twice a day, every day? Is there steroid use? So we might see sudden weight gain or sudden weight loss. So yeah, so sex and drugs, how can we talk about the teenage years without talking about sex and drugs, right? So on the healthy side, there is going to be this curiosity, right? They're going to be looking around, what are the other kids in the high school doing, right? In terms of smoking and making out and so on, and having their own thoughts about this, and where do I fit in? What groups am I going to be attracted to? Subgroups, and what groups am I going to want to stay away from? And there also very well may be a questioning of one's own sexual orientation, right? The studies show that 1 in 10 of us is gay, lesbian, or bisexual, right? So it's there. And how is the family going to deal with it, or or the school going to deal with it? Will a child feel safe to explore those thoughts if they are there? So again, on the unhealthy side, anything around sex and drug use that is interfering with their social academic functioning is going to be a concern. Risky sexual behavior. In some families, we may have a zero tolerance policy, right? So any underage smoking or drinking will be great concern, and that's not a bad policy to have. Other families do have some flexibility there, but whatever that rule is in your family, you want to be clear about it with the child and have the consequences when they cross it. But any type of use that interferes with their functioning must be addressed. And around the sexual orientation, if you notice that a teen has sort of fear of these feelings that they're having, and they're maybe bullying other people or victims of bullying, you want to be able to have that conversation with your kids, that if it is happening, that it can be addressed. Okay, so in cognitive development of adolescents and teens, there's some themes that we see. This idea of an imaginary audience, right? Everybody's watching me, right? A personal fable, nobody feels like I do, right? I lost my boyfriend, I lost my girlfriend. You might say, well, that happened to me too. Oh, but you didn't love like how I loved, right? It's very, very real to them though, right? There's a sense of idealism, right? So teenagers, for better or worse, can see things the way they ought to be, or the way they think they ought to be. And they get very disappointed with us and parents when we're not acting at our best, right? And they see that hypocrisy and they will point it out. And that can lead to some argumentativeness. And another issue with teens is dealing with either overachievement or underachievement. So some things you might hear, and some of these things might not sound so healthy, but they're normal, right? It's like, so if your child says they can't go outside because they have a pimple, right? I wouldn't say that there's something wrong with my child, even though it sounds like there is. But that's a typical thing that a teen would say. It's not necessarily a sign of dysfunction. Nobody understands me, or them telling us we're such hypocrites, or wanting, desiring to do their best, or even understanding that I don't have to do my best. These are all kind of healthy things or normal stresses for teens to have. And again, the unhealthy side, withdrawal from activities and peers, and sometimes an immersion in cyberspace. Working with teens, you learn of the world of Warcraft. Does that ring a bell to anyone? If you have teenagers, you better know what that is, because your kids might be there and be spending a lot of time in these sort of virtual reality worlds. Not that they're bad things in and of themselves, but when they're choosing the virtual social interactions over the real social interactions, more often than not, that could be problematic. We want to watch out for depressive symptoms, obsessive worrying, incessant arguing, which is different than being argumentative sometimes, and irrational demands. I must excel at everything I do. It's awful if I don't, right? Or the other extreme, I don't care whether or not I do well. Now, in terms of socio-emotional development, teens start to have a more complex self-understanding. They're able to kind of think about how they think. They develop a sort of abstraction. Peer influence becomes more important than parental influence, and this is very difficult for us as parents. There's challenges for self-esteem during this time. They're in the process of gaining skills for independence in terms of their academics and their career. And there's also a struggle with their different cultural identities, right? So what does it mean to me? I'm raised Catholic or raised Jewish. Do I believe what I've been told? They start to question these things. What does it mean to me to be a member of to be black or to be white or to be Puerto Rican or to be Italian? Like, what do these different identities that I have really mean to me? So you'll see a healthy questioning, right? I tell my child, hypothetically, I want you to be a doctor. I want you to be a doctor. Well, you get to be a teenager. Do I want to be a doctor? Right? So I start questioning those things. What is important to me around finance? Is it similar or different to my parents? Right? Religion, like I mentioned earlier, and having different concern over my ability to choose a career. In this day and age, the economy provides a certain amount of stress. The amount of options that are available to our children nowadays can provide a certain amount of stress. Moodiness is normal. Changing friends, changing styles, changing how your hair is and your clothes are, your interests. These are all sort of normal. They can look abnormal, right? But they're normal is the point. A lot of these things have been repeated, but if we look at the pattern of risky self-defeating behaviors, we want to be concerned. If we see hopelessness, we want to be concerned. Self-downing, putting ourselves down. I'm never going to be able to do this. And abrupt negative changes, around their peers and their activities could be a sign of concern. And how do you judge what's negative? There's no easy formula for that, but you know it. If it quacks like a duck, right? It's usually a duck. And then going from a teenage, that was a good one, right? Okay, going from a teenage to young adulthood, right? Our job as parents I think is quite simple to define, is to launch the child into adulthood. So during the childhood years, we really get to mold and shape them, and we have a good degree of influence that we can apply. But as they get older into the teenage years, we start to lose that influence. Genetics take over, peer influence takes over. So we want to do our best to guide them, to tell them, to suggest and express with love and concern what we think is right, but to also, they have to go they got to go out and do it themselves, right? And there's a limit to our powers as adults. And some of us don't want to give up those powers, right? And we hang around real close as they're trying to be on their own, right? So there's challenges for us as parents during this time, and there's challenges for our young adult children during this time as well. So having your adult child, start to express doubt about themselves, should be expected. Having them have concerns about adjustment to school or to the world of work or to living on campus or to making new friends, these should all be expected, feeling overwhelmed, having financial concerns. When we start to see them failing classes, we start to see them losing jobs, start to see an increase in alcohol and other drug use, obsessive thoughts, social withdrawal. If they're on a college campus, the college counseling centers are a great resource. You have licensed professionals that can utilize those services for free. If they have a job, lots of jobs now have employee assistance programs. Use those services that are available. And if they're still on your insurance, you can send them to us and we'll take care of them, right? So what could we do as parents? There's a balancing act of encouraging their independence and staying connected, right? So it's almost like telling you to do two opposite things, and that's the challenge of parenting, right? The back and forth dance. When do I come close? When do I step back? When do they really need me there? When do they really need to struggle on their own a little bit, but know that I'm close enough to you, right? We want to encourage participation in extracurricular activities. So in the early teens, get involved with sports or the arts, community service. These are all great predictors of success. And even through young adulthood, in college, getting involved with clubs and organizations, or if you're entering the work world, not going to college, being involved with your church or religious institution or doing volunteer work. When we talk to our teens, to use what's called I statements as opposed to you statements. You statements are the things we say when we kind of yell at our kids and we call them different names, what's wrong with you type of statements, right? Which lead to defensiveness and shut down communication. But when we focus on ourselves, I'm concerned about you when I don't hear from you. It's difficult for me when I don't know what's going on with you, right? It makes it a little easier to have a conversation. Active listening, let your child know, let your teenager know that you understand how they feel, right? So when they tell you something, this is kind of, using those basic counseling skills really, but like, it sounds like you're scared, it sounds like that was overwhelming to you, right? That can go a long way with building a connection towards your teen or young adult. Encourage the freedom to disagree. Disagreement with you is predictable. It's going to happen to all of us who are raising kids. Our kids are going to disagree. If we make a demand on our children, our teens, that they don't disagree with us, we're going to get mad, they're going to get mad, it's going to escalate and escalate. Encouraging a freedom to disagree, it's going to happen. Let's talk about how we're going to disagree, and let's make it constructive, right? So we can get something out of this process. And the big thing, natural consequences. This one's kind of hard for a lot of parents to do, is to allow our child to experience natural consequences. Now, I don't know, they're preparing for their SATs, right? You don't think they're studying hard enough for the SAT, right? You paid for Kaplan or Princeton Review or hired a tutor, whatever it is, and they have their school that they really want to get into. And their school has whatever the score is minimum to get into that SAT. If you don't get that score, you're not going to get to go to Cornell, right? If you don't get, you really want to study because the SATs matter at Cornell, you let them know in a few times, a reasonable amount of times, but then you have to let them experience the natural consequences. If they don't get the SAT, they don't get their first choice of school, and then they have to go to a school that they didn't want to go first, and deal with it. It's a good lesson to learn. Maybe you got to go to county college, maybe you have to go somewhere else locally, get your grades up and reapply. But allowing our children to experience those natural consequences after we've done what I would consider, a reasonable amount of guidance and so on. So how we treat anxiety through a modality called cognitive therapy. The idea with cognitive therapy is not the situation that causes anxiety, but it's our thoughts about the situation that cause the anxiety. And often with anxiety, we see something called cognitive distortions, ways of thinking that convince us of things that aren't really true. And everybody uses these cognitive distortions at times, but they're only problematic when they lead to depression and anxiety and so on. So through the process of therapy, both parents and teens and children can learn to identify and change cognitive distortions. If you don't get straight A's, your future will be bleak, right? That's a cognitive distortion. It's something called all or nothing thinking, right? I imagine there's a certain percentage of people in this room who did not get straight A's in high school and college and are doing reasonably well in life, right? So we want to encourage our children, for example, look at shades of gray, to strive and do things the best that they can, right? But often these cognitive distortions go unlabeled, they're not dealt with, and people act like they're true, and they cause a great deal of anxiety. So here just, there are many examples, mind reading, Jenny ignored me, she must be mad at me. Well, I don't know, maybe Jenny didn't see you when she was walking in the hall. Maybe she was concerned about something else. Maybe she thinks you're mad at her because you didn't acknowledge her when she looked by, or whatever it is. So if we see mind reading, we want to encourage people to get the facts. And sometimes with anxiety, we overestimate the risk of danger. I'm never going to be able to pass this class. I'm never going to be able to succeed. And we want to understand what the real odds are there. Well, the only time I've ever really failed the class is when I didn't do the work. So in the process of cognitive therapy, we try to help people understand how their thinking causes anxiety, which is a different type of therapy than you might see on The Sopranos or in treatment or in different movies. They don't usually model cognitive therapy. It's more of a straightforward, empirical, problem solution focused type of therapy. And just a brief word on medication. For anxiety, cognitive therapy is the frontline treatment before medication. So if your kids have an anxiety problem, if you have an anxiety problem, you don't want to go to your primary care physician first because they will give you medication. It might help, but it's not going to really do it the way cognitive therapy will. Medication may be helpful with cognitive therapy, but we want to try the cognitive therapy first. So the antidepressants are actually also used for anxiety with children and adolescents. Benzodiazepines, which is your Xanax and your Ativan, generally not recommended for kids, only recommended on a limited use for teens and adults, and we would consult with a psychiatrist if we feel that the child is not responding to cognitive therapy. And I believe that's my last slide, so thank you.
Generally, the first appointment, I like to have parent or both parents present, and I'm going to get a basic history of what's been going on, what the problem is, how long it's been going on, and certainly family history, developmental history, and then I would be meeting with your child. So it is important because it gives me a good overall picture from your perspective of what has been going on and how long it's been going on for.
As far as cognitive therapy or cognitive behavioral therapy, I'm going to try not to get on my soapbox too much. Out in the world, just about every therapist is going to tell you that they do cognitive or cognitive behavioral therapy. In reality, it's not true. At our center, everybody is board certified in it. Currently in New Jersey, I think there's 23 or 25 board certified cognitive therapists in the state. So it's a very small percentage. When we talk about cognitive therapy or cognitive behavioral therapy, I don't believe they're very different nowadays. Cognitive therapists work on people's thinking, they work on the way they're perceiving things, but then we also have to work on their behavior. Because what happens is in anxiety disorders, people engage in things called safety behaviors. What's a safety behavior? Well, I have this terrible thought, and now I'm going to act as if it's true. One of the big, like we said before, safety behaviors in people who are anxious is avoidance. They'll avoid things. And unfortunately, every time they avoid something, it reinforces that negative assumption. So in cognitive therapy, we help people to evaluate things, see things clearly and realistically, and then we get their behavior in line with what makes sense. We don't have them engaging in these safety behaviors, which in the end make them feel worse.
So when children are going through stress, it has an impact on the parents, and a lot of the work I tend to do is more with the parents, and getting parents to be able to have a conversation about how are we going to raise the child, right? So there's a lot of things that couples do that couples don't necessarily talk about, like how are we going to manage money, how we're different values about religion, when we want kids, right? And a lot of times couples don't have these conversations explicitly, and they only come up when a problem arises. So when there is a difference in values, right, that is something that can be addressed in therapy, because sometimes the conversation gets a little too heated when it's just the two of you, and having working out in a couples counseling setting can be helpful, or even if one of the partners come in, taking a look at how we're reacting to our wife or reacting to our husband that may not be the healthiest way, how we may be interpreting things or misinterpreting things, and going through that process could be a very useful way to use cognitive therapy.
We are often victims to our thinking. We all are. We all get hijacked by our ideas and assumptions. And when we get hijacked by our ideas, we often feel bad. And I often say, of all the bad things you thought about, once again, how many really happened? What happened? And half the time people say, what? It never worked out the way I thought. It worked out better. And so if we can teach kids skills to learn how to think clearly and realistically, which quite frankly we could all use, they'll end up feeling better. And so what I try to let them understand is that cognitive therapy is different. We're going to teach you skills. We're not going to come in here and it's not going to be all totally mushy and all that kind of stuff and talk about this or try to get you to cry. I don't like it when patients cry. So again, it's a skill-based thing. And often kids will sort of connect with that when they realize that's not what we're going to do.
If we're talking about therapy with children, I think it's crucial that the parents come in, and a lot of the times I will meet with them by themselves for a few sessions maybe, or maybe alternate. Sometimes I've done that. So one session it's child, and then the next session the parent. So because you have to learn skills too to help reinforce what they're learning in therapy. It's really important because once they leave, they need to continue practicing the skills that they're learning. And so it's important for you as a parent to understand what those skills are and then what you can do to make sure that that's being reinforced at home.
I'm just going to put a little caveat on that. I think it depends on the age of the child. Because a lot of times when you have younger kids, at least we don't have a problem working with the parents, right? It makes sense. When you're working with a teenager, right, they don't want their therapist working with their parents, right? Because then they think you're going to spill the beans on them. So I think it partly depends upon the age.
Well, I've had, and I'm not working with the children, parents come in 2 years old. They're experiencing, just maybe some anxiety and stress. They have some stressful situations. Maybe it's related to divorce situation. So they're now one of the parents have moved out of the house, and it's stressful and anxiety provoking. So generally, I'm not working with a 2-year-old. I can't. So I'm working with the parent, and I'm helping them develop some strategies and some skills to help their child.